knew that early childhood was a particularly vulnerable time for children to be living through an experience like the pandemic. We also knew that there wasn't a lot of good data to inform policy decisions at that time. And we had a very clear sense that things were changing in a dynamic way, sort of frequently enough, that we needed a survey that could really capture family voice and amplify it but in ways that were scientifically rigorous in order to inform decisions that would be made moving forward. Why is economic hardship a particular concern for us? Well, it's tied directly to how well parents and their children are doing. So here you can see a very clear relationship between the number of areas in which people are struggling to make ends meet and the levels of emotional distress that we're seeing. So white households in our sample, really the challenges that they're facing are mostly related to the social deprivation and social distancing that's occurred because of the pandemic. Missing family members, isolation, sleep problems, anxiety, things like that. When we look at what are the concerns that are raised the most by Black households, you see that basic needs is by far the biggest one, but that other ones like debt and house, car problems, paying expenses, all of these material hardship issues are weighing heavily on Black households. And it really, this tells the story from our perspective of two different pandemics that have been experienced in very different ways. We have found that healthcare, just family healthcare for families with young children has been affected. So 83%, 84% of our households report that they have delayed getting healthcare for some health problem for themselves or one of their family members. Over 40% of our households have missed at least one well baby or well child visits. And that number is actually even higher. Half of households with a special needs child have reported missing a preventative healthcare visit. That's a great concern to us, especially with special needs households, because of the amount of developmental monitoring and referral to services that can happen in healthcare for kids with special needs. Childcare. So childcare is another huge area of intersection between kind of family well-being and what this country needs to be able to get back on its feet. We see material hardship rates at the same levels as we're seeing in households, if not a little bit higher for providers. So 45% of all of our providers that we've surveyed to date report at least one form of material hardship. We see the same structural inequalities based on race and ethnicity. We're talking about what needs to be done in terms of policy efforts, and especially local policy efforts, because as we know, policy starts at the federal government, but really it gets implemented at state and then county levels and into communities. And so we see really four cornerstones and they're really intersecting cornerstones that we should be focusing on. One is financial stability and relief. That continues to come out for us as the biggest issue. The other three cornerstones, first of all, systems change really needs to happen in order to have more coordinated and integrated child and family services. Also, we know that everyone, that parents, that children, that providers are all going to need emotional support from formal sources, like from the provider world, from home visitation and other kinds of programs, and informal, more support for family and friends. We found that one of the biggest interrupters of the chain reaction of hardship that we've observed is the extent to which people have emotional support in their lives. And then time is the fourth cornerstone. People need time so that when they're sick, they can have paid sick leave and they can focus on their health and well-being, paid vacation time, which everybody is entitled to and needs in order to recreate and re-energize.